Hi, everyone. We're the Health System Strengthening Team. We're going to present to you today to close out the foundations of global public health. So our team consists of Galatia, myself, Roseanne, Emily, and Tiffany. So a little bit of content overview. We're going to be discussing the importance of health system strengthening, the disparities across all the World Bank regions, introduce some UN agencies and their current frameworks to improving health systems, critiques and challenges along the way, as well as priority action items that we believe should be at the forefront of global public health.
So what is a health system and how do we strengthen it? USAID describes health system as a unit that consists of all people, institutions, resources, and activities whose primary purpose is to promote, restore, and maintain health within our communities. Health system strengthening comprises of the strategies, responses, and activities that are designed to improve the health system performance and health outcomes. It's important to focus on strengthening the healthcare system because it is an integral part of reducing the overall global burden of disease. Ultimately, in order to advance positive health outcomes, a health system needs to be stable because it is the foundation to achieving these positive health outcomes. So how do we measure the strength of the healthcare system? USAID and country health information systems and data use created a tool that measures health systems on a scale, and the strength of a health system through this scale is measured in terms of the functionality of processes related to healthcare, and this incorporates accountability, affordability, accessibility, and reliability. So this tool includes questions about these several factors, and it's rated on a scale from either occurring none of the time, some of the time, most of the time, and all of the time. And it provides a score in each core area that aids a health system in understanding their performance and functionality, as well as the immediate health outcomes that occur as a result. It can serve as a guide for health systems to make adjustments to strengthen their functioning as a system. So health systems and the COVID-19 pandemic. Obviously, as we're all well aware, the COVID-19 pandemic highlighted many concerns with capacity and equity of health systems across the globe. This pandemic highlighted concerns in the equitable distribution of resources, and showed that health systems were already overburdened pre-pandemic and could not handle a crisis once it occurred. This was evident through the lack of PPE, medical devices, space for incoming patients. And all of this basically encompasses the idea of emergency preparedness. A solid health system is essential in order to handle a crisis like a COVID-19 pandemic, but it can also a health system can also be overwhelmed by any type of crisis, financial or otherwise. So just some quick facts from the Commonwealth Fund. Approximately 30 million Americans don't have health insurance, and 44 million Americans have minimal coverage, which results in a continuous burden in terms of cost of care. And this goes back to the points mentioned on the scale on how we measure the strength of a healthcare system, because it encompasses those accessibility and reliability points.
Hi, everyone. My name is Rovi, and I'll be giving an overview of the disparities within health system strengthening and how each region is affected differently and in very significant ways. So within the last few decades, we've observed large strides in reducing poverty, increasing access to education and healthcare, and even had targeted campaigns towards improving health outcomes for children in our most vulnerable communities. Although much has been achieved, there are still areas in which progress has stagnated and where resources and services come up short. This is especially true in lower income countries in areas that have experienced great hardship due to epidemics, conflict, and natural disasters. And as previously mentioned, now during the pandemic, so many gaps have been introduce and come to light. As we've learned throughout this course and from other presentations, there's so much to be done in areas such as infectious disease, NCDs, climate change impacts, mental health, and global health security. Health system strengthening essentially is an approach guided by the idea that if there's a stable and productive system to equitably work towards a healthier population, we will be more prepared and equipped to handle current and future global public health issues. So I'm going to go ahead and get started talking about the African region. Looking at the different World Bank regions, we see disparities impacting the way health systems are developed, rebuilt, and progressed. So in Africa, factors that have contributed to the slowed progress in achieving SDGs and the slow progress to developing greater and more resilient health systems include inconsistent financing and the lack of priority setting to ensure that funds are not misused or wasted. In the 2010 World Health Report produced by the WHO, it was estimated that around 20 to 40% of health system spending was actually being wasted. And this is not specific to just the African region, but to all other regions collectively. Moving forward, health systems in Southeast Asia and the Pacific regions are facing high healthcare costs and difficulties improving ease of access to quality services, especially for developing populations, social populations, and an aging population as well. Several setbacks have occurred to improving health systems, such as natural disasters, and continued incomplete data to inform public health initiatives has been a challenge among this region as well. In Europe, we see a big push towards a more people-centered health system. However, with this, there are challenges in service and delivery integration to ensure that one portion of the health system isn't working in isolation. Europe and other regions that host higher income countries are facing issues that are considered high-hanging fruit, such as service and delivery quality assurance, and other factors built in for long-term care. Moving forward to Latin America and the Caribbean regions, we see health systems which are deeply fragmented and continue to struggle to guarantee and provide equitable health care. There is still plenty of populations that are excluded from healthcare decisions and rights, such as women and girls, the LGBTQ community, indigenous people, and ethnic minorities. And finally, the Middle East and North Africa region. This region specifically and significantly faces large disruptions in their health systems from both political and financial instability. We can see this highlighted in this bar graph from data taken from the Institute of Health Metrics and Evaluation, looking at healthcare access and quality access. And they measured this by taking the incidence of mortality and morbidity in all of the M&A countries. From this, we see none have reached 100%, and the lower half indicates large gaps in quality healthcare and access, especially in Iraq, Yemen, and Djibouti. Moving forward, we have a snapshot of Africa on the left-hand screen illustrating the relative functionality of each country health system, with the red to yellow range leaning towards 40 to 50% functionality, while the green blues are averaging above 60%, which indicates still large gaps in progress for a sustainable health system that is serving all their populations. The right-hand graph illustrates inequality of vaccine distribution in the World Health Organization regions. And while we can see that a lot of the doses have been distributed to areas with greater global deaths, we see an obvious and unequal distribution of vaccine for COVID-19. And we can also see this in other vaccinations, especially for children. The last illustration here highlights 11 high-income countries. And on the left-hand side, you can see that they were ranked by quality care, access, efficiency, equity, healthy lives, and lives saved, as well as health expenditure. And we shouldn't be surprised finding out that the United States is ranked the lowest among all these high-income countries, despite having the highest health expenditure per capita. Overall, a productive and equitable health system strengthening approach supports and directly impacts other public health interventions and should be at highest priority for institutions and governments looking to improve the health systems to relay positive health outcomes for all their people. Low prioritization of health systems is an indicator for slow achievement of sustainable development goals. Without having a reliable or resilient infrastructure, much more of the population is left vulnerable and exposed to preventable diseases.
The slide is about addressing systems health strengthening among who. The World Health Organization actively works to address strengthening of health systems. WHO is a specialized agency of the United Nations that is responsible for public health concerns internationally. The 2030 Agenda for Sustainable Development was enacted by the United Nations in 2015 to provide a blueprint for sustainable resources for urgent public health concerns. There are 17 Sustainable Development Goals that work to initiate effective and efficient methods to combat public health disparities in developed and developing countries. Strategies that need to be improved consist of health and education, reduction of inequality, economic growth, and environmental sustainability, such as climate change and preservation of ocean and land ecosystems. According to WHO, there are 6 building blocks of health systems that aim to strengthen the framework of health systems. These building blocks consist of proper delivery of health services, which aim to deliver effective, safe, quality personal and non-personal health interventions to what populations are in need, when and where these resources are needed. They should be accomplished with the sustainable model to eliminate waste in relation to health resources. Proper performing health workforces aim to be responsive, fair, and efficient in order to achieve the highest health outcomes for prospective populations in relation to available resources. Therefore, there should be a broad, diverse, competent, responsive, and productive staff. Proper functioning health information systems ensure the production, analysis, distribution, and reliable/timely use of information for health determinants, health systems performance, and health status. Proper utilization of health resources ensures equitable access to essential medical products, vaccines, and technologies. This is to ensure quality, safety, efficiency, efficacy, and cost-effective use for health resources, thus reducing over and underutilization of resources. Proper health financing systems refers to the allocation of funds for health systems to ensure populations receive the proper care services, thus protecting organizations from financial harm. And leadership and governance ensures strategic policy frameworks exist, as well as combining with proper system design, appropriate regulations and incentives, and accountability. Priorities by WHO used to address health system strengthening within the health systems framework consists of proper delivery of health services in association with delivering packages of care within health system frameworks, consists of prevention, promotion, and treatment of populations. Therefore, the development of mechanisms for integrated service delivery is enacted. Proper performing health workforce consists of how countries design programs to facilitate integration across service delivery and disease control programs, finance organization at various levels of the system, such as primary, secondary, and tertiary, monitoring and improving performance and effective workforce labor market. Proper functioning health information systems consist of generating population data such as census, household surveys, civil registration data, public health surveillance, medical records, data on health service and health system resources, and having and detecting, investigation, and communication, public health security. Proper utilization of health resources consists of policy standards, guidelines, and regulations, reliable manufacturing practices, and quality assessment, supply storage and distribution systems to minimize waste and maximize patient safety and training, as well as proper health financing systems consisting of raising additional funds, reducing reliance on out-of-pocket payments, improving social protection and vulnerable populations, improving efficiency of resource allocation, promoting transparency and accountability in health financing, and last but not least, leadership and governance, consisting of policy strategies, defining goals, collaboration across sections, and influence, key determinants of health and access to health services, regulations, system design, reducing of fragmentation and accountability, as well as transparency.
All right, I'll be briefly talking about the global systems and also discuss solutions for strengthening health infrastructures. So what are some global systems that play a role in health system strengthening? So these agencies are the largest agencies in the world, and they work towards providing health equity on global, national, and regional scales. And they are the World Health Organization, the World Bank, the United Nations Children's Fund, UNICEF, and the Centers for Disease Control and Prevention, CDC. So what do these agencies have in common? So each organization collaborates their efforts with national and local governments, policymakers and lobbyists, ministries of health, local organizations such as community centers, nonprofits, and outreach platforms. And each entity plays a role pertaining to strengthening healthcare on a global scale. So these agencies rely on each other. So they rely on governmental, nonprofit, policymaking, and community outreach support to ensure progress in these countries' health. And some of these healthcare agencies also do work together for various reasons, such as expediting vaccines, research effort, data collection, and raising awareness on health barriers. So the World Health Organization is an agency of the United Nations, and they work towards bringing various communities together in order to enhance health equity. And they have three primary core missions. So the first one is to work towards providing universal health care coverage. And what that can entail is improving access to quality essential services, working towards developing financing and financial protection, working on measures that promote access to essential medicinal and health products, training workforce healthcare workers, and working on labor policies. Also working on data collection and monitoring. So the second core mission would be preparing for health emergencies. So what that can entail is preparing for emergencies by identifying, mitigating, and managing risks. That can also include supporting the development of tools necessary for outbreaks, working on initiatives that help with responding to acute health emergencies, and also supporting health services, especially in fragile or dilapidated healthcare systems. And lastly, the third mission is to work on initiatives that help with prioritizing general health and well-being efforts. That can also include addressing certain social determinants and promoting intersectoral approaches for health. The World Bank is an agency that works with over 189 countries, and they work on ensuring sustainability through poverty alleviation, and they do a lot with providing funds for initiatives. And also, the World Bank has two core missions. Their goals are to end extreme poverty, and the second one is to promote shared prosperity. The third agency is United Nations Children's Fund, so the UNICEF. It's an organization that incorporates partnerships with governments, communities, governments and communities to help uplift children in need, and they do this through several initiatives. So the first one is to work on efforts that help with child protection and inclusion. So that can entail child safety, environmental protection, general child protection, disability protection, and much more. The second one would be child survival. So that can include ensuring children have access to immunization, sanitation needs, having access to HIV/AIDS medication and information, early developmental needs. So with education, that support can include early childhood developmental tools, support in education emergencies, disability support, also gender equality for both young boys and young girls. Social policy refers to reforming social policies to ensure children are shielded from lifelong crises. Emergencies refers to humanitarian actions. So gender equality, that would include incorporating equal opportunities for both young men and women. So making sure that young girls have just as much access to education, healthcare, and nutritional needs as the boys do. With innovation, that can entail encouraging students to utilize resources that help with fostering creativity, such as STEAM support and business development. So when it comes to supply and logistics, that also refers to the distribution of supplies and resources such as menstrual pads, vaccines, clean needles, HIV medication, and bed nets. And lastly, research. That category is in reference to data analysis and also surveying for resource allocation. Lastly, so the Centers for Disease and Prevention, the Centers for Disease Control and Prevention, the CDC, is a health agency that works towards protecting lives through healthcare safety and preventative initiatives. So they have several missions in the 21st century, and that includes health security, providing scientific research, support for medical care provision, disease prevention, and also nurturing general health needs. So several health agencies have tried to address this topic of why infrastructures in place have weak health systems. And for instance, the World Health Organization would define a well-functioning health system as having trained and motivated health workers, maintained infrastructures, effective coverage of medicinal supplies, funding for resources, and also developing strong health plans with evidence-based policies. But they also acknowledge that that's not always the case in many healthcare systems in different countries. So they acknowledge that there is a lack of strength pertaining to controlling and addressing global public health threats and disaster preparation. And this is an issue in low, middle, and high-income countries. And examples would include epidemic diseases and ecological disasters. And some of our biggest examples of epidemic global health crises, especially in the 21st century, would include the COVID-19 pandemic, the malaria outbreak, and also the Zika virus, which affected the sub-Saharan regions of Africa, Southern America, the United States, and other tropical regions of the world. All right, and why hasn't this been accomplished? So there are several issues. So the largest global health crises have arisen within the last century due to lack of emergency preparation. So this is a very prevalent topic in this day and age. And with emerging epidemics, pandemics, and endemics, it's going to continue to be a problem without the proper tools and plans in place. The second thing would be low GDP per capita for healthcare resource allocation. That's another big issue. So pertaining to low GDP per capita, this is a big issue in many low and middle income countries. And they're facing this issue due to the lack of prioritization of healthcare needs on a governmental scale. And prior to the COVID-19 outbreak, countries with dilapidated healthcare systems were strongly dealing with the effects of limited access to resources. There were a lot of issues with drug stockouts and also vaccine delays. Examples of countries with low GDP per capita in healthcare resource allocation would include Ethiopia, India, Pakistan, Malaysia, Timor-Leste, Laos, the Dominican Republic, and Fiji, and there's many more other examples. Also, representatives of the WHO organization have addressed that low healthcare coverage will continue to be a problem for future disasters and cause strains on livelihoods. So funding for healthcare initiatives, that also ties back into the lack of prioritization of healthcare needs and low GDP per capita. So without governmental support and funding, many communities won't have access to the basic needs. And also additionally, presidential terms can play a role in healthcare funding, especially in the US. Like for example, we've had certain leaders prioritize specific initiatives over the other, which affects healthcare coverage greatly. So limited healthcare facilities is another big issue in many countries, and it greatly affects civilians living in the more remote regions of the world. And that's going to continue to be a problem if there isn't a prioritization or prioritization of that. Lastly, universal healthcare coverage. That's another big issue. Lack of universal healthcare coverage is a big issue facing many countries, especially in the United States. Without it, we're leaving many low-income families with limited access to essential services and needs. Additionally, this can cause complications, especially with private healthcare and private insurance companies profiting from pharmaceutical drug markups. So solutions for improving health systems. We have several as a group that we came up with. So the first thing that we think should be prioritized is developing efficient emergency preparedness plans. That's a big solution. So with that, we can utilize it to help mitigate future health crises and also improve screening tactics. And also having a strong preparation plan will help with controlling small outbreaks and preventing them from becoming big disasters. The second solution would be producing universal healthcare coverage globally. With that, that'd be amazing because that can help with declining non-communicable diseases. And with universal healthcare coverage, we are also giving more families access to preventative healthcare services, such as testing and screening for diseases. Also, many low-income families will highly benefit from this because it minimizes financial burdens. Another solution is increasing expansion and funding efforts. This is really important. If we increase our efforts in healthcare, in providing healthcare facilities and research, we can minimize future disasters. And lastly, improving communication efforts. So we think it's imperative that governments and healthcare agencies improve their efforts and work towards advocacy. And working on communication efforts would be really important for planning for the next future crises that could arise. So pertaining to health strengthening, I also wanted to address that the World Bank has a lot of projects that they're working on with specific countries like Turkey, for example, to strengthen healthcare divides. And they're doing a lot right now with universal healthcare coverage. They've also collaborated with, some of their research programs have collaborated with World Health for research expansion. And they're working on initiatives right now with global financing for women, children, and adolescent healthcare needs. And basically, the goals of these projects are to enhance hospital management support, refine primary and secondary preventative methods for non-communicable diseases, and overall just improve policymaking decisions. And lastly, I wanted to highlight a really good example of that. So the World Bank and the Japanese government have worked together to develop an emergency preparedness plan. And this framework is being used to create a resilience plan, and it's going to be implemented for future disasters such as earthquake disasters, epidemics, and other healthcare crises. And overall, this is a good representation of how communicative efforts amongst government, healthcare infrastructures, and emergency response teams are imperative and necessary for disaster relief and response efforts.
So in this discussion of health system strengthening, I would like to just summarize some of the priority actions towards improving health systems around the globe. So our top three would be universal health coverage, building capacity for primary care expansion, and greater investment in monitoring and evaluation methods. So in increasing UHS universal health coverage, we're looking to guarantee coverage for basic healthcare needs. That's looking for your annual checkups, your vaccinations for children, vaccinations for adults as well, and increasing coverage of any other ailments. Building capacity for primary care expansion is really a subset of universal health coverage that should be a requirement. A couple of factors that would entail building capacity would include cross-training for CHWs, looking at incentivizing doctor visits, especially to target reproductive, maternal, neonatal, child health, and other methods. Investment in monitoring and evaluation will greatly reduce the gaps in information and coverage and increase more accurate and more quality service and delivery. And investing in greater monitoring evaluation also informs more accurate and equitable health policy, as well as helps in the prioritization of investments. So this is just another graphic, overall summarizing what a health system working towards resilience looks like. So we're having leadership and governments, information, health workforce, financing, medical products, and service delivery are the key factors that build up what a resilient health system should look like. And we would just like to end our presentation with the end of someone else's presentation given by Dr. Ellen van der Pol. Her presentation was talking about curing health systems in order to increase positive health outcomes globally. All right, so if you weren't able to hear the end sentiments of her presentation, we'll go ahead and link it in our discussion thread. But this concludes our presentation. Thank you so much for your time.